I think that Lyme disease is a major epidemic. Certainly in the U.S., we now know there are over 300,000 cases a year. It's 6 times more common than AIDS. It's almost twice as common as breast cancer. It's a huge problem, and it's something that has been ignored pretty much by the medical establishment, and that's a big problem. Well, it is a bacterial infection, so it's something that theoretically is treatable because you can treat bacterial infections with antibiotics. So it's something that if we had the right diagnosis and diagnostic tools and the right treatment, we could probably get rid of. But at this point, the diagnostic tools are terrible. The treatment is inadequate. We're using antibiotics that are 60 or 70 years old, which don't work very well. And also, I think we're going to be seeing some new information about transmission of Lyme disease that will change the way that people look at the disease. My hopes are that we will have more recognition of this disease, that we will have better diagnostic testing that's developed, and that we will have better treatment. And when I say that, I'm thinking of something like HIV disease or hepatitis C disease, which were fatal illnesses, and now, hepatitis C, we have a 97% cure rate with these wonderful new designer drugs that we have. That's what we need for Lyme disease. We need drug companies to step up and start making better treatments for this disease. And it shouldn't be all that hard because we know so much about the Lyme bacteria. I mean, we know much more about that than about either HIV or hepatitis C virus. So it shouldn't be that hard to do that kind of engineering and make these better drugs. I think that there's a small group of experts within the infectious disease community who have sort of taken over the Lyme disease area, and they have maintained their view. They don't want to admit that they're wrong because that's what they would have to do. I think there's a lot of liability involved if they do admit that they're wrong. And because of that, they're maintaining this very narrow view of the disease that's basically, suppressing all advances that need to be made. And that's the biggest problem. If you look at the history of AIDS, the Infectious Disease Society, which is now doing this with Lyme, did exactly the same thing with HIV disease. When it was discovered that it was due to a virus, the IDSA came and said, okay, now we know it's a virus, we can, we'll take care of it. And they did absolutely nothing, and everybody was dying. And so this group of other physicians said, wait a minute, this isn't working. And they formed the American Academy of HIV Medicine, which is why actually to this day we have 2 AIDS organizations. We have the AHIVM and we have the IDSA arm that finally, when they saw that, they said, oh, well, we better get involved. And also the drug companies came and said, there's billions of dollars here. You guys better get with the program. So everybody then got on the same page and started working against HIV. That hasn't happened in Lyme disease. That's the problem. We still have the IDSA saying, oh, well, don't worry about it. It's no big deal. And then we have all these sick patients, and we have ILADS, which is saying, look, this is bad. This isn't working. We need something better.